Hi, doctor. So I'm here for my CT scan results.
Hi, my name is Aaron. I'm one of the doctors here. May I know your name, please?
My name is John.
Nice to meet you, John, and thank you for coming here today. So I have your CT scan result. I'm sure you can see that in your screen as well.
Yes.
Okay, so just give me a second. I'm going to draw a simple diagram to explain to you what is going on.
All right.
Okay, so just give me a few seconds. Okay, so the first thing that I want to show you, John, basically this is a very simple diagram of a liver. Okay, and this is two small tubes that join to a pocket or a bag over here. This is called the gallbladder. Its function is to concentrate a substance called bile. Bile, you can imagine it as a detergent whereby it's used to break down fat or cholesterol. Okay, so that it's usually stored in here and then later secreted or thrown out into this small tube called the common bile duct into the intestine. All right. So the first thing that I could see from the CT scan is there is a very small, we call it a lesion in the CT scan report, but what it really means is there's something here very small, about the size of 10 by 12 millimeters. It's a single thing over your liver. We're not too sure exactly what it is at this point, but that tells that we need to arrange further investigation to find out what it is. Okay.
Oh, that sounds concerning.
Well, John, I can only imagine how distressing that must be for you, but let me assure you, I'm going to do my best to figure out what exactly this is and treat you before it becomes more serious. Is that okay?
Okay. Yeah.
All right. And the second thing that we found in the CT scan is that there are multiple small stones in your gallbladder. For example, like this. Can you see here? This is your gallbladder. The CT scan is also showing that there are many small stones around here.
Oh, is that very serious?
Well, this condition, thankfully, is a very treatable condition, and I'll talk to you shortly about how we're going to do that. Okay?
Okay.
So there's another thing that the CT scan have shown. Just give me a few more seconds. I'm just going to draw this very simple diagram so that you can follow me along. Okay, so basically, I'm just going to show you the large bowel along with where the problem is. Okay, just almost there. So, John, just a few more things I've drawn here. So this is the food pipe coming in from your mouth, and then it goes to the stomach, and this is where the stomach continues into the small bowel, and then this continues into the large bowel here at the back, as you can see, right? And this is where the stool comes out. This is the anus. Do you follow me so far?
Yes.
Okay. So the third thing that the CT scan is showing is many small pockets. Okay. Many small pockets over the part where the bowel continues downwards, where just before it exits the bowel, right? There's many small pockets around here. So this is called a diverticular disease. And like the CT scan is showing this as well.
What is a pocket?
Okay. So basically a pocket is like a small defect in this in the large bowel, where it comes down. It's basically just like a small, like, can you imagine like a defect in the wall which forms an extra space, like if I were to draw it on the side, it probably just like a pouch like this. For example, if this is the wall of the bowel and this is a small pocket on the side, if you will see it on the side, it's going to look like that. If you see it from the front, it's like this.
Oh, I see.
All right. So the possible causes of pain, John, that I could think of, it's probably it could come from the liver. We don't know what this is. And the other thing is there are many small stones. If the stones move somehow into the common bile duct here, that could cause a lot of pain as well. And the third cause of the pain that I could think of is it could be due to the inflammation around here or something that is around here. Okay, so these are the few reasons why you could be having the pain. Do you follow me so far?
Yes, I do.
Okay, and John, the next thing I want to talk to you about how we can investigate further. Okay, so for now I will start with the blood test. I will do some full blood examination where I look for signs of infection. I will check your mineral salts in your body, and I'm also going to check your kidney function, your liver function. I'll do an inflammatory marker. On the other end, I will check the blood test for your prostate. I will also look for something called tumor markers in the blood. Okay, this will help me guide the next step in the management. And furthermore, for the liver over here, the few things that I'm going to do is I'm going to arrange an MRI scan for you. And if you can't go for the MRI for any reason, we can also arrange a very specialized CT scan studies to further investigate what is the possible cause of this. And in case we are not too sure, the next thing we can do is to take a tissue sample from this. It's called a biopsy, whereby we take a tissue sample and we see it under the microscope to find out exactly what it is. And depending on what that is, we can treat you accordingly. You follow me so far?
Yes. Okay. Yeah.
All right. And the next thing that I'm going to do is regarding your this stone on inside the gallbladder, I'm going to refer you to a surgeon, a specialist. So what they will do is they will first assess you further. And if indicated, you may need to undergo a keyhole surgery whereby they have to remove this gallbladder, all right, the sac over here, so that there will not be any more stones that are formed and going into your common bile duct. Do you follow me?
Yes.
All right. Is it clear so far?
It's clear. Yes.
Okay. So the third thing that I'm going to show you is that it's this. Okay. So the next thing is this. So this is quite a common thing, quite a common condition. It's called a diverticular disease. So the way I'm going to manage you is I'll give you some advice on diet. For example, you need to take a high laxative diet, meaning that a high fiber diet, and I'll give you some laxative to soften your stool so that this will not become more or will not aggravate this further.
Is this disease permanent?
This condition can be treated or can be managed well when you have some dietary changes, okay, as well as if you take laxative, for example, when your stool is soft, it doesn't make this worse or it does not form more diverticular disease.
Okay. All
right. So that can be managed. But for now, the CT scan is also showing that this cannot be differentiated from something more serious. Okay. So what I'm going to do is I'm going to refer you to a gastroenterologist or a specialist that they will scope, or they'll put a small camera that goes from your mouth downwards this way, and also a camera that goes from this way to figure out, to look and really see the whole intestinal system to figure out if there are any more like these suspicious things. And if there are, they will just take some tissue samples to study it under the microscope to figure out what that is. And depending on what that is, they can advise on the further management.
Okay.
Okay. How does that sound to you?
Yeah, that sounds fine.
All right. In the meantime, I will see you in about a week once the blood tests are back, and I'll give you some reading materials on all these conditions, and I'll review you very frequently for your pain. Okay. How does that sound to you, John?
Yeah, that sounds good. Thank you, doctor.
All right. That's excellent. If anything, you can always ring me back as well, John.
All right.
And
Thanks.
the red flags I'll give you along with this. Okay. Thank you very much.
Thank you. Bye-bye.